I think there might be too bad. And then, it does, it looks really nice. Alright. Okay, and then got everything.
Think
Plugged in
so.
and charged? How did you bring it?
IT. I got one.
Hey, never mind, sorry. Yeah, no worries. Don't highlight the shows up, and then there's something that shows up that doesn't have any keyword. That easy one to turn out. Yeah, you get to learn about that. I love it. We all.
Oh, you stole the card. I couldn't.
I did.
couldn't-
Sorry, do you
No,
need
it's
it?
okay. Custodio does some creative things sometimes. I just couldn't imagine what.
Where they put the card? I stole it.
Well, I won't tell if you don't.
Is this one of the mics that you need?
Sure. How many do you want? I think I had
3
a
would be
order.
great.
Okay, you got it.
Yeah, that's not necessary.
Check.
Stop it.
Check. Sam. Okay, we're good. Batteries are good. Yes.
It works.
think I might come a little closer over here so I'm not blocked by those people, if that's okay.
Oh,
I
yeah.
don't want to crowd you too much, but then hopefully people won't walk through here anyway.
Yeah, that's a good thing. Okay.
One of us can stand up here too, and have people in, but we don't have to sign. We have plenty of us. Yeah. Our people are start, we're gonna have to do both full natural and then social distancing. Just actually. Yeah. I think like this will always. Yeah, I got in the building and the font looks good. It is okay. You're in. You get the best seats now. So cool. Where's your first day of your summer camp? Oh my God, yeah. Summer camp. Yeah. Hello.
I'm with you, let's go. That's, do you want to sit on the left side? Yeah.
One, two, 1, 2. One, two.
Rare. But then you go to hang it. That's what, yeah. Every so often. Every so often. Yeah. Right.
We have refreshments coming up
So I kept his hair count. Free cash.
Or maybe.
I finally left. It said, it basically. Yeah, but right now, I mean, I figured it out.
I got it all figured out, they put it in wrong.
Fangled buttons and knobs and flashing lights.
Can we throw a bat on? Or we just have it sitting on the desk.
But the projector.
Well, he stole my projector. Man, I'll come up with something. I have another projector card.
Hello, welcome. How are you? Good to see you both. Nice to see you. Yeah, I'm sorry. It took me so long to get back to you because Ashley got it.
That's right, yeah, I got that text message.
Yeah. We had a, you know, there was a real long strike. Is that how it goes?
So what do we have in the time?
Right after that.
About 10 minutes to be after that.
Yes, actually on the computer. I can pull it off my computer. And it has measurements on it.
Oh, fantastic.
Hello. Welcome. we can't make a virtual PowerPoint, that's okay. We can-
Yeah, I'm sorry, I didn't realize you had a PowerPoint, or I would have been ready.
You didn't have it in your hand, so you didn't have it.
Yeah.
How many people do you guys think you got coming?
I think it's around 40.
Hey, we're not. Good space to
Yeah,
utilize.
luckily we were able to trade with facilities had it reserved, and we pushed them out.
Good reason.
Yeah.
Here with us. Thank you. Normally I stand. My nervous and basic heart rate. I'm not that.
You muted it?
I bet.
Okay. I suggest an encouragement that we're filming this and the camera only hears.
Oh, noted. Okay.
Favorite ice cream.
Favorite ice cream, cotton candy. It is kind of you get a price hill.
Oh, Melissa, if you want me to splice your slides into the video.
We are about ready. Probably 5 minutes.
Good afternoon, everyone. We'll be getting started here in just a few more moments, but I just wanted to draw everyone's attention to the amazing cookies that are sitting back over here. If you have not had an opportunity to try a cookie, I highly recommend it. I plan on having 2 once we're done today.
I tested them for everyone, they're safe.
You can figure that out. Airplanes out of like lightsabers and sticks of gum and like all these little things that you can like very expensive and they see. I was gonna say that. Sounds good over there. Yeah. No. All the eggs. Yeah. And the peas are like so
Hello, welcome everyone. I think we'll kick this thing off. For those of you who don't know me, my name is Matt Brown. I am the Sales and Marketing Director for Rogue Valley Manor. I'd like to thank you all for coming and for your interest in Rogue Valley Manor. We have a wonderful panel of directors here today. I'll start over here and introduce you really quickly, and then I'm sure you will get to know them as the day goes on. Melissa has put together a wonderful presentation that she has shared with residents and with prospective residents in the past. So we have a lot of information for you. I am recording this, so if you would like to get a copy of it afterwards, please just let us know or let your sales counselor know, and we'll make sure to send it out to you. Over here, I'll start with Leslie LaRocca. She is our home care administrator. Next to her is Erin Williams. He is the nurse navigator who kind of helps our residents plan all of their health care as they move through the process. Sydney Allinson is our administrator of the health center. Melissa Preston is our associate executive director. She is super helpful in all things healthcare. So I always point people to her for any questions I can't answer. Next to her is Jill Gianni. She is the administrator of Care Suites, which is our higher level of care comparable to assisted living. And next to her is Tammy Killington. She is a manager from the Memory Care Center, and she is going to help us understand how that process works as well. So welcome everyone. I'm going to turn it over to Melissa. Thank you for coming, everyone. I really appreciate you being here and helping us put on this home care.
Thank you for that wonderful introduction, Matt. And thank you all for being here with us this afternoon. It's great to see such a large turnout for our Continuum of Care conversation today. And let me just echo Matt's sentiments about the directors here on the stage with me or up here in the front of the room. This is a very, very experienced group of healthcare professionals. And the combined years of experience that we have amongst us is extensive. So I believe most of us have over 20 years of experience in healthcare. So a lot of expertise here in front of you. And so I invite you to ask any member of our panel questions, or if you want to follow up afterwards, we'd love to have that conversation continue with all of you. But let's go ahead and get started about Rogue Valley Manor and what a continuum of care looks like and how you navigate it. So our agenda for today is to help you understand the different levels of living services that are available here at Rogue Valley Manor, understand how residents move along the continuum of care, including a temporary move or a long-term care type of transition. We also want to help you recognize the value of planning ahead to preserve your choice, your independence, and your own peace of mind. Matt already did a great introduction of our team. Here's just a little bit more information about us. And because of our team's diverse background, I'd like each member of the panel just to give a little bit of insight to you about their experience and their role here at Rogue Valley Manor. So I'll kick us off. My name is Melissa Preston. I've served as part of this community for 23 years. Predominantly my experience is in healthcare, so I am both an assisted living administrator as well as someone who served in the role of a practice administrator. I've served as a home care administrator, and I've helped out in skilled nursing and memory support as well. Just checking. Jill Gianni, I'm the administrator of the Care Suites here at the Rogue Valley Manor. I am a licensed practical nurse, and I have my RCF administrator's license. In addition to that, I have been managing the Care Suite since it opened in 2009. So I have a lot of experience. I know that facility forwards and backwards and can answer all your questions assisted living related.
Good afternoon. My name is Tamara Kellington. I worked at the Manor for 21 years. I worked in the health center, in the clinic, in the Care Suites, and in memory care for probably the last 12 years. So fairly well-rounded and anxious to answer any questions and help anybody along.
Hi there, I'm Sydney Amundsen. I'm the health center administrator, so I'm over the skilled nursing facility here at the Rogue Valley Manor. My experience is predominantly social services. I did that at a sister community in Portland and then transferred over here. I got my license to become a nursing home administrator a few years back, and I have been in this role for about 2 years now. And so, welcome. I'm here for any questions that you might have.
I'm Aaron Williams. I'm a registered nurse here at the Rogue Valley Manor.
I've been with the Manor now 23 years, going on 24 years. I've worked at various capacities throughout our building here. I started out as a clinic nurse. I worked in our skilled nursing facility. I was the assistant director of nurses there, pre-pandemic, I'll say, because that changed a lot of things. And I've helped out in all of our licensed care areas as a nurse in various capacities, so I know our system really well, hence why I'm the nurse navigator. So you'll hear a little bit more about that shortly, but welcome. We're here for all questions.
Hello, I am Leslie LaRocca, the home care administrator. I've been with the Manor about 8 years. I was in the health center for about 5 as their staffing coordinator and the administrator for home care over the past 3 years. I have been in healthcare for about 25 years now, originally in a clinic setting and then most recently the past 8 years here at the Manor in long-term care, and it is amazing. And I have to share that being in a clinic for so many years of my healthcare experience, I was new to long-term care, I was new to this type of setting and a community setting like this. And I have to say, when I came in for my interview here 8 years ago, it completely just changed my way of thinking and how wonderful it is here, how happy everybody looked as I was sitting there waiting for my interview, so nervous. And as I looked around, I could see everybody everyone had their place, everyone was smiling, everybody just looked comfortable and happy. And I realized then that this is where I wanted to work and where my passion was. And I have felt the same way every day for the past 8 years. This is a lovely community. Welcome.
Thank you all. You know, I'm very proud of the tenure amongst our leadership team, amongst our staff overall, but especially among our leaders, because one of the things that we did see following the COVID-19 pandemic was a shift in folks wanting to get out of the healthcare field. And I'm very proud to say that we have the same leadership team that we started the pandemic with. They've all stayed as part of this community, and I think are probably even more dedicated as a result. And so we're very, very proud of our leadership team here. And as you're exploring options in other types of communities, that's something I would get curious about if you're shopping around, so to speak. What is the tenure of staff? What is the turnover rate at a community that you're looking at? Because that tells you a lot about what you should expect of someone that lives there, how well you'll get to know those leaders that you need to build a relationship with, so that when the time to have some of those conversations that needs to happen, you have that trust factor already in place. And tenure and leadership is what builds that trust in that relationship. So a really important factor as you're looking at different types of communities. All right, so why a life plan community? You probably don't need healthcare today, but one day you may need a little help after surgery. You may experience a temporary illness. Your spouse's needs may become such that you need support in managing them. Or you may simply just want peace of mind to know that that support is going to be available when you do need it. I would say that the greatest benefit of Rogue Valley Manor isn't where you live, it's knowing that you will be supported as you continue to live here. And this is the team that helps with that support. So I like to look at our levels of living and our levels of services as more of a menu, not necessarily a ladder, but really a menu, because not every resident's journey is going to be the same. Most residents start off in independent living. Oftentimes they will experience some sort of short-term illness or some change in their health status that they may bring in home care to their independent living home. When their needs become such that they can no longer be scheduled, they often will make a move to the care suites, which is our assisted living, and receive that support around the clock there. Sometimes when someone experiences a memory impairing illness, it's time for them to move to the memory support center. Or you may have a situation where one spouse is the caregiver for their loved one and they need some respite and they need an option for their loved one to go and receive some short-term support so that they're able to go see a doctor or play around a golf. We also have our skilled nursing facility. And as you're looking at other types of communities, this is something really important to pay attention to, because skilled nursing facilities are closing across our nation right now. And that doesn't mean that less people need skilled nursing. It just means that there's a change in the healthcare landscape happening. Skilled nursing facilities are rated by the Centers for Medicare and Medicaid Services. They have a star rating system. And so as you're looking at other types of communities, it's important to be able to compare them apples to apples. Are they a true life plan community, which means that they do have skilled nursing as part of their continuum of care? And what is their skilled nursing facility rated by CMS? That's something that we'll get a little bit deeper into, but as you're exploring your options, those are some of the things that are important to compare. So let's talk a little bit about navigating the continuum of care. And I'd like Aaron Williams to describe what his role is at Rogue Valley Manor as a nurse navigator, because that might be a title that you won't come across often as you're looking at other types of communities.
Just out of curiosity, has anyone ever worked with a nurse navigator? Usually you see them with insurance companies, checking in, say, post-hospitalization, maybe even in the hospital sector. They're like nurse educators. Has anyone ever worked with nurse navigation? A couple hands. Yeah, it's kind of a newer role for nurses. It's one we've embraced here, and we found a real need after, especially post-pandemic. You know, with the sectors all changing, rules and regulations changing, there was a need for education when it comes to the changes in healthcare. And partly that's where my role developed. So we've taken that kind of system that's, you know, designed in those sectors and brought it into a continuing care community, which I think we've embraced it pretty well, and I'm pretty lucky to work with these individuals, which makes my job easy. But more so, nurse navigation is that we're navigating the healthcare system, so that when you're experiencing complex situations, whether in a hospital setting or at home, we can have that communication to determine what are the needs of the now. And I think that's the important piece with navigation, because as you're going through healthcare changes, I mean, that's what your focus is on. You're not worried about rules and regulations and Googling, you know, what does that mean for the state of Oregon, so to speak. That's where we come in. We get to help you with that understanding of those situations. I think I look at, you know, nurse navigation as very holistic. This is about you. I can tell you off the top of my head, there's been not one situation that's the two are the same. They're all different. It's all complex based on where you live. You know, are you alone? Do you have a spouse? I mean, family dynamics. There's so much that's involved in that, which can play out to, you know, how it's perceived and how things can continue for yourself. And that depends on the support we bring into you. I think that's the piece that with navigation and discharge planning and things like that, we get to work with you directly. And I think that's the piece. And at the end of the day, it's your say. You get to determine what that looks like for yourself. My role, I work with the hospitals. I work with both Providence and our Asante system, which is a local hospital system here. I work with them. I go to the hospitals. I see our residents there when you know, things are changing, or if there's some complex situations. I work with the discharge planners. So I work with them really closely. I work with the doctor's offices in the Valley. I work with a lot of specialty clinics, especially when we talk about surgeries. We'll talk a little bit more about these kinds of situations. But I'm very much plugged into the community here and the resources that are around us, likewise, as well as all of our licensed care areas. So when the time comes for changes and moves and things like that, I can direct you to the right resources and have those early conversations. So yeah, that's in a nutshell kind of what I do.
Oftentimes a resident's first interaction with our healthcare continuum is with Aaron, because they might be experiencing a situation and they don't know what to do, or they don't know what they should be asking about. And Aaron is that on-campus resource that understands our programs, understands the resources that are available in the greater Rogue Valley, and he can come alongside our residents and help them through that journey, because the healthcare system is very complex. Everyone's insurance policy is slightly different, and how that policy may work for them might be different. And so Aaron's able to help navigate that system. So let's talk a little bit about independent living and what residents expect when they're living in independent living. So when we think of independent living, we think that that is truly you living within your own space, managing your activities of daily living, and knowing when you might need to bring in help to help support what's going on in your daily life. If a resident is experiencing a change in what their needs are, we have Aaron to help navigate that. And we also have a resident services department, because not every change is related to healthcare, and sometimes there's other factors at play that need to be addressed. The services that are provided in independent living include things like housing, dining, amenities, and of course, access to all of the additional support services that we offer here. Typically, independent living is paid for by your monthly fees. Optional services, like for example, in-home care services, might be covered under something like a long-term care insurance policy if you live in independent living and you happen to have one. One of the features that we are very, very proud of here at Rogue Valley Manor is our on-site primary care clinic. So we've talked about the landscape of healthcare changing over the past few years. And unfortunately, one of those things that we're seeing is a departure in primary care providers, especially those that are accepting Medicare or Medicare Advantage patients. And our business is typically those people that are Medicare or Medicare Advantage patients. And so it was really important to us to ensure that we had a sustainable clinic model that was accessible to our residents that choose to live here. Many of our residents move into Rogue Valley Manor from outside of the Rogue Valley, and they have to establish with a new primary care provider. So having access to quality primary care that's integrated into all of our health services programs was something that was a priority for us. And so this past year, we actually brought our clinic back under the operation of Rogue Valley Manor. And we now employ Dr. Michelle Rushton, Veronica Burke, and Chelsea Jennings as our on-campus providers that our residents and our staff are able to establish their primary care with. It works out beautifully for our residents because the same doctor that you're seeing in the clinic is the same doctor that will see you in skilled nursing or in memory support or in assisted living. And that continuity of care is very important. It's also great because our providers understand how our systems work. They know that if they have a patient that is experiencing some challenges, that we have an Aaron Williams that can come alongside that patient and help them navigate those challenges together. All right, Leslie, why don't you talk a little bit about home care?
Sure. Home care's goal is to come to your home and provide services to you. And that's our goal, is to try to keep you, well, to keep you safe and healthy and happy within your home. So when your needs change, home care will come in and help you with those activities of daily living, whether it be shower assistance or something as simple as housework, taking you to an appointment, just companionship. And so our goal is to allow those services within your home as long as you wish, before you need to move to a higher level of care. And if you choose to or don't choose to, if you want to stay home, that's great. Home care will come to you and bring all the care to you so you can stay in your home.
We recently did a presentation for our residents about the different options that we have here on campus. And one of the residents in that presentation shared that she's hired home care to come in and clean out her refrigerator for her once a month. I thought that sounds like a great way to use home care. All right, Jill, how about the care suites?
So the care suites is our licensed residential care facility here. We, in that setting, so typical assisted living, we have caregivers or CNAs available 24 hours a day in that setting that can respond and help you with maybe something that's planned or maybe something that isn't planned. And so if you might need some extra help getting up and going to an appointment one day, we will go in, help you get up, get dressed, gather paperwork for you, and help you get to that appointment, schedule the transportation for you. All of our rooms have call lights in them, and so if you need help, you just have to hit that button. It pages the aide that's assigned to you. They'll come in and help you with whatever it is that you need. Let's see. We have Veronica Burke comes once a week and sees our residents there that are under her care. So that's been a huge bonus, where you might not be feeling well. You can actually have a provider come to you in that setting. We have nurses on site, not 24 hours a day, but most days of the week. And so if you have something acute going on, they can pop in and help to assess you, help to be that bridge to the provider, and ideally keep you here rather than having to go out to the hospital for something.
I'm glad that you mentioned the nursing part of that, Jill, because as you're looking at other types of communities, that's another good question to ask, especially in an assisted living environment. How often is the registered nurse on site, and how many hours per week are they on site? Because assisted livings do not have a requirement to have a nurse on site all of the time, sometimes you'll find that communities tend to have very light nursing coverage. And our perspective is, we're caring for people and and our caregivers are taught to provide that care. We want to make sure that we have a registered nurse that's supporting that along the way. And in addition to Jill being our licensed practical nurse and our administrator. So nursing coverage is really important. And that's something that you should be asking about as you're comparing different types of settings. All right, Tammy, memory support.
Okay, our memory support, we moved to a brand new building 8 years ago. We have the capacity for 40 residents. They're in 2 neighborhoods of 20. I am the facility nurse there 40 hours a week. I have another nurse that works beside me an additional 2 days a week. We're on call 24 hours a day. We have a very robust activities department. We tend to focus a lot on our social model for our residents. They aren't necessarily sick. So we try to enhance their life by our activities. And so that's very important to us.
I would say if you have not had the opportunity to visit our memory support center, it is something I would highly recommend. It is a very, very special home for the people that live there and a place that I love to visit because they have so much fun. And you walk through the home and you see that fun happening. And memory loss is something that often happens in the demographic that we serve here. But it doesn't have to steal that person's joy. And that's what we see in our memory support center is a lot of joy happening. And that's a great thing to see. Talking a little bit more about our memory support center, and I can take this one, Tammy. We were very, very proud to be able to offer to our residents a respite day program. And that program is designed to come alongside a caregiving spouse and be able to give them respite. So whether they want to go play a round of golf or they have a doctor's appointment that they need to attend, they're able to bring their loved one and that loved one can participate in the activities that are happening at the Memory Support Center. They can enjoy a meal with the residents that live there, and that caregiving spouse can get a little bit of a break that they likely need. And that's a really, really great enhancement to our program. All right, Sydney, let's talk about the health center and skilled nursing.
Let's talk about it. So our licensed skilled nursing facility is covered by 24/7 nursing. And so that's the biggest difference between us and our care suites over here at our RCF facility. We also work very closely with insurance companies. And so we are contracted primarily with Medicare and other managed care companies. And so just while you're shopping, keep in mind, check your benefit with your insurance carrier. Just make sure you know exactly what they cover. There's a lot of managed care plans that like to advertise some good deals, but at the end of the day, you pay big copays. So just check those while you're shopping for long-term care. That's my biggest nugget of knowledge that I want to just share because we deal with this very often. Another big difference that we have while you are shopping and you're looking around for other long-term care opportunities, we have Chelsea Jennings, who's our nurse practitioner that comes in a few times a week. We also have our medical director, Dr. Rushton, who's also the medical director in the clinic here at Rogue Valley Manor. And she's also with us multiple times per week. And so our regulation for skilled nursing is that you're seen once you admit into our facility within 10 days. But our nurse practitioners, our medical director, they're on it. They'll see you within 24 to 48 hours. We don't round with providers, but it almost feels like we do because they are so active and they love to keep tabs on their patients with or without you actually seeing them in clinic. And so that's something that we hold dear to us. It's what we believe is strong patient care. So keep that in mind. Ask long-term care communities what their provider status is, if they have a contract with other skilled nursing facilities in the area. Do your research. 5-star ratings across the board are on Google. Just Google it. And then you can also see the last 3 years of surveys within each skilled nursing facility. So do your research. We have a 5-star within ours. We do very good care. I love what we do. And if you have questions regarding skilled nursing and what is offered, that tends to be a big area that people are searching for. And so I'm here for, if you want to have a conversation afterwards, or if you have questions and I don't know the answer, I'll get back with your sales rep to get that to you.
One of the beautiful things about the skilled nursing business, second only to the fact that it is one of the most highly regulated industries in the country, is that you are able to really have transparency. And so you can go to Nursing Home Compare, which is operated through the CMS.gov website, and you can look up all the skilled nursing facilities in your county, and you can see what they're rated. And they're rated on 3 areas: health inspections, which occur annually or based on a complaint. Their staffing, so how many hours per day they're staffing registered nurses, if they're in compliance with the Oregon state ratios for CNAs. And then quality measures. Are they producing the right outcomes for the patients that they're taking in and providing care to? And I'm very, very proud of Sydney and her team, because we are a 5-star facility, and that takes a lot of work, a lot of strategy, and a lot of dedication. We've been a 5-star facility since the rating system was originated, since it was created, and I'm confident that we'll be able to maintain that 5-star rating because our team does an incredible job there. All right. We also offer some additional services, both on an inpatient setting and an outpatient setting, and that is physical, occupational, and speech therapy. We partner with a company called Functional Pathways, and they come alongside us and provide those services in the skilled nursing setting, as well as in the outpatient setting for residents in independent living or assisted. It is a great integration into our wellness program, because often what we will see is a resident will, for example, no longer be able to swim 30 miles a day. We have very active residents here. And so they'll go see Dr. Rushton, and she'll say, I think we need to do a referral to Functional Pathways across the hall and get you tuned up. That resident will go work with physical therapy for a period of time, and then the therapist will identify that they may need some ongoing exercises and refer them to our wellness team for personal training. Wellness team comes alongside that resident, and in no time they're back to swimming their 35 miles. Because the integration is really what makes a difference. There's that continuum of care, because we know that as we age, our bodies are going to change, our abilities are going to change, but we want to be able to do what we love as long as possible. And so having that continuum of primary care to rehabilitation back to wellness is really important to us. All right, so beyond our continuum of care, we also have some on-site support services. We have a dentist and a dental hygienist that are here several days out of the week. We have our Functional Pathways team that I already highlighted. And then we also have a clinical psychologist and a neuropsychologist that we contract with that provide services to our residents, primarily in the skilled nursing setting. But what we have come across is that, unfortunately, there are times when a resident needs to have a certain type of cognitive testing, and that referral pipeline might be 6 to 9 months out to get that testing. And so by having our own contracted neuropsychologist, we're able to get that testing completed here on site and get that resident and their family the results that they need so that they can plan accordingly. All right, how are decisions about care made? Erin, why don't you kick us off about this? Let's talk about our transfer committee a little bit.
Well, usually it's devised by the group that you see up here in front. But more importantly, it also involves our physicians and such. And really what it comes down to is what you want. Ultimately, how we decide as a group isn't the one size fits all situation, because it's very individual based. And I would say that we take into account, again, that holistic approach, what your situation looks like, and work with you and work with your families. If you aren't seeing one of our physicians, we work with your physicians out in the valley. That's one thing we want to get your physician involvement in right away, especially if it's something that's quite challenging. And then we come back to you. We say, hey, here's our recommendations. This is what we think. What's your thoughts? We do that with your family. I've had Zoom calls with people clear across the country. In other countries, if your family aren't local, that's the great thing about technology. And probably the one thing that's probably been a benefit of the pandemic is all this awesome technology that we have now. But we really do reach out to your loved ones, the ones that you've identified as your representatives, to help make those decisions palatable and to get you into a safe place, whatever that looks like. So Ultimately, you get to decide that. We can only tell you what our recommendations are, and then we proceed forward however that looks. So that's kind of a typical situation, I would say.
Your independence and your choice is our priority. And I've joked with residents that yes, we could probably do open heart surgery on your dining room table, but we're not going to recommend that. We're going to make safe recommendations based on our experience and our expertise. And hopefully we can give you options so that at the end of the day, you're able to make the choice that works best for you. All right, so I want to talk a little bit about Mary, because I think this is a great example of how our system works. So Mary enjoys gardening, volunteering, and traveling. She has a knee replacement surgery. She saw Dr. Rushton. Erin helped her coordinate services. She spent 14 days in the health center getting back on her feet. She returned home with some home care support because there were still a couple things that she wasn't able to do by herself. Three weeks later, she's back walking on campus. Nothing changed for her except the support that was needed. And that support was able to be provided by the systems and the services that we have here at Rogue Valley Manor. And that's just an example that we see every day here in a lot of different ways, customized to what that person's choices are. All right, so this is your homework, right? Here's the questions that you need to take back with you, and questions that I would hope you would ask of us as well. So if my health changes, can I remain with the same community? If my loved one develops Alzheimer's disease, where do they have to live? Is it just down the hill at our memory support center, or is it across town where I have to drive over if I want to have dinner with them every night? How are transitions between care levels managed? Is it up to me and my family to seek out all that information and make those decisions by myself? Or is there a support system there to come alongside me and help me know what my options are? Is there someone who helps coordinate my healthcare needs after a hospitalization or illness? If I'm a single person and I get released from the emergency department at 2 o'clock in the morning, who can I call? How do I get back? Those are some of the things that we have to think about. How long have healthcare leaders been with the organization? I mentioned before, this is a really important factor. What happens if my spouse needs a different level of care than I do? What's included in my monthly fee and what services cost extra? You'll see this oftentimes in the assisted living environment where there's a base fee and then there's level of care fees on top of that. We have that same structure here at Rogue Valley Manor, and we can explain why that level of care comes into play very easily. How are residents and families involved in care planning? I think that's another really important factor because not always are we able to verbalize what our own wishes and choices would be. And so how is a community coming alongside you and involving the people that know you the best in helping make the next best choice for you? It's really important to ask those questions. All right, this is a little tickler sheet that I'll make sure that Matt gets out to everyone, but it just goes over our levels of living in a different way, the type of care and services that are provided there, what you should expect in those care and services, and then how it's typically paid for. And again, as you're comparing communities, this is a number, and how is it? Because sometimes that's how communities accomplish some of these needs. But overall, what I would say is that the greatest value of being part of a life plan community is that it's not just about where you live, it's about who's going to be there when you need it and the type of support that you'll have when the time comes. And with that, now we'd love to invite you to ask us as many questions as you possibly have, because we have a lot of answers, and if you don't know the answer, we'll find it out for you. So questions?
Really, no questions at all?
Oh, there we go. Usually just takes one to get it started.
Thank you very much for a fantastic, very reassuring. Also to see that you all have at least, each one of you, at least 20, 25 years of experience and that you've been working in this community. So that's very reassuring. Just wonder if you take a couple minutes to relate at least a little bit about how you handle the COVID panic, especially with people who are living in the manor and in the
best.
I would be happy to talk about that because I'm so proud. I'm proud of this community and how we came together as residents and staff in a period of time where there was a lot of unknowns, and we put the priority of everyone's health and wellness at the front of everything we were doing. So, you know, like many communities around the nation, there was lockdown in several of our areas. In our skilled nursing facility, there was a period of time where residents weren't able to have visitors. And that was really hard for our residents and their families. We had the same happen in our assisted living in our memory support center. And in our independent living setting, a lot of the activities that residents love to do and what drove them to move into a community like this had to be put on pause because it was not safe for us to gather together in groups. But as quickly as we were able to, we started putting things in place that created safety once more. We grew different types of programming. Our Inquiring Minds program actually grew out of the pandemic, and it's been one of the most incredible additions to, I think, to our community. But it started with, how do we bring activities to residents that aren't able to gather in groups any longer when you live in a community setting like this where everything is community driven? We brought the vaccine here as quickly as we could, and in this room, we, in one day, vaccinated this entire campus. 800 residents in 8 hours. And several of these nurses here, I think, probably have long-term carpal tunnel from having as many injections as they did. But it truly was. It was a community effort. It was putting guidelines in place that helped people feel safe, even if they didn't necessarily agree with those guidelines. It was ensuring that we had adequate resources in case we did experience an outbreak. So we stockpiled everything that we could, from PPE to we made it our mission to always have vaccine on hand so that we were able to quickly get people vaccinated. And those programs continue today. We just had our most recent COVID booster clinic just a couple months ago. And now vaccinating 800 people in a day is not really a big deal to us anymore because we do it every 3 or 4 months. But you know, I don't know if that answers your question, but I would say, you know, we came together as a community. We put guidelines in place that kept everyone safe. And we, very fortunately, were not one of those communities that ended up with the tragedy that you saw in so many places. It's not to say that we have COVID outbreaks or that we don't still have outbreaks. We are just very, very good at managing that risk and making sure that people stay well. You're very welcome. Very proactive approach, and a lot of really great nurses.
I'd like to talk about Mary. So Mary had a knee replacement, but for a year before that, Mary was having trouble walking, kneeling. So how did Mary get to the fact that she needed a knee replacement for the year prior to her knee replacement?
That's a good question. So Mary routinely sees her primary care provider here on campus. And that primary care provider during those examinations is talking with her about, you know, what's going on in your day? Well, wait a minute, you're not getting down to breakfast anymore? Why not? You're not going to that group fitness class anymore? Why not? And as those conversations are evolving, we're looking at what Mary's needs might be. Maybe Mary can't make it down to the garden any longer, but she still can make it down to the fitness studio. And so how do we get her to the fitness studio so that we can keep her moving as much as possible? Dr. Rushton might refer her over to functional pathways to get some physical therapy to see if that will solve the issue. But ultimately, if she needs to have surgery, Dr. Rushton's letting Erin know. Erin's working with Mary, and they're getting that surgery scheduled and then that aftercare planned for. I'll take it a step farther. Sometimes those surgeries are no longer involving hospitalizations. So what used to be a 3 midnight stay in the hospital is now an outpatient surgery that you're, you know, coming home at 8 o'clock at night from. But what happens if you're not able to be at home at 8 o'clock at night after that surgery and that anesthesia? And that's why we have an Erin Williams, so that we can contingency plan for what that might look like. It may be a stay in a skilled nursing facility. It may be going home with home care, but we'll have both options laid out for the residents.
It's wonderful that there is an Erin Williams. My question is, I'm guessing he might like to take vacations and once more.
No vacations for Erin.
What happens?
I live here.
What happens then?
Aaron does get to take vacation, and his time away is very, very important. But that's why we have a team approach, and I'll let him describe what that approach looks like.
I appreciate that. Yes, I do take vacations. I'm a Disney fan, if anyone cares. You know, the great thing is I'm surrounded by a great group. So when I am off, I make sure that people know, you know, who the resources are, who the contacts are. In fact, my out-of-office responses will direct you to who to contact right away, whether it's a hospitalization or direct in-home care kind of situations. Resident services is always available also. There's always 2 people in that office. So if I'm not there on a whim and you really need to talk to somebody right now, resident services is a great resource as well. But when the system, as the system functions as a whole, it doesn't change when I'm out of the office. I can assure you that system is very well in place. The hospitals know us very well. I've made that very much apparent. Despite the changes in personnel, which we've been seeing still to this day. But we're very much in their pocket. They know us. We have lots of conversations. In fact, today I've had a continuing phone calls with discharge planners at our Asante hospital today prior to this meeting. So they know us. That partnership, I think, is very important because one, it addresses the need of you, and what does that look like getting you back here? And can that be done safely? And I think that's the piece that's important. So even though I may be taking a few days off, which I will, we've made sure that they know who our contacts are. So that never goes amiss, so to speak. But one thing I will like to add, that if you do have elective surgeries, let us know. Because sometimes those elective surgeries, like Melissa said, you know, you're going home the same day. Do you have the equipment that you need, or do you even know what equipment you may need? I think having those conversations with us, we can already get support in the home to prepare you for that. I can even give you a list of questions to ask your surgeon. Like, am I being admitted? Am I being admitted under observation, or am I admitted under inpatient? I mean, I don't know if you guys know the difference of that, but that could be the difference of qualifying into a skilled nursing facility or not. So it's just these little nuances that you may not be aware of. I'm going to educate you on that and what the questions to ask. So there's a lot of variations of that, but I'm going to make sure that, you know, we're giving you the you know, the willpower to understand what the care looks like that's designed for you, what that looks like coming home. So yeah, it may not require coming into our facilities, but at the same sense, we want to make sure that you're very well aware of what that looks like going home. Okay, so.
We're not Big Brother, but we do like to keep an eye on our residents. And one of the other benefits that we have in having our own primary care clinic on campus is that we use Epic as our electronic health record system. And so you have the same Epic MyChart that you may experience now as part of our program. And one of the benefits we have is when one of our residents that is a patient of our clinic goes into the Asante hospital system, we're alerted, we're notified. So even if that resident can't notify us because it was an emergency, we have a system in place that allows us to have that information delivered to us so that we're able to keep an eye on what's going on. And then Aaron follows that person along while they're in the hospital and keeps an eye on their records to make sure that if there are things happening that he needs to get involved in, we can proactively do that.
I also get the security reports. I think that's another element to this, the story of the situations. So when we get security reports, 911 calls, things like that, I get copies of that so I can see kind of what systems or you know, emergency responses that were activated on your behalf. So then that gives me a kind of idea of what's the next step. Was your loved ones contacted? You know, your representatives, were they notified? That's where resident services will get involved as well as which hospital did you go to? So that gives me an idea of which discharge planners to contact. I have a great list of phone numbers of which areas of each of the floors of the hospital to contact. So it's really designed to really make sure that we're looking after you. When you're in a situation of healing or discomfort or you're in a medical crisis, you don't have to worry about all those rules and regulations. We're behind the curtain already working on your behalf, and you may not even know it. But we've already been in the discharge planners years. I've had the health center already involved early onset with hospitalization. So yeah, there's a layer there that most places probably won't offer that you will probably see. I think is, I don't know, above anything I've ever seen out there in the industry. So I'm biased though. place.
I think it's above, but I think it's, at some point, it will become the new norm because it's what's needed. Because the system has changed and it's more complex and insurance companies can be difficult to navigate and work with at times. And so having a nurse that can come alongside and speak the language that the insurance company is speaking and that the surgeon is speaking is really an added benefit that may currently be unique to Rogue Valley Manor, but it's something that I hope other communities will embrace as well.
Can you talk about the ownership structure of the Medicare company and its financial liability? Because that's the risk from our perspective in signing on with an organization. The upfront expenses that you guys require and what's the likelihood of ownership change or financial challenges.
I can take that one. So, you know, we're proud that Rogue Valley Manor is celebrating its 65th year this year. And we are very financially solid and sound. And I think that if you were to review our financial records, you'd see that to be very much the case. We are part of the Pacific Retirement Services family, but we are our own entity. And so the money that is invested into Rogue Valley Manor stays here at Rogue Valley Manor.
And they do not own Rogue Valley Manor.
Yeah, we are our own 501c3, and we do have a sole corporate member, which is Pacific Retirement Services, but we are our own company separate from Pacific Retirement Services. Does that answer your question? Okay. Sorry, I'm like leaning around here. It's hard for me not to make eye contact when I'm speaking with someone, so.
I think it's fantastic that you have on-site medical people here, which is great, and this is extremely helpful, so thank you for doing this. My question is, if you have a medical need, how long does it take to get an appointment with the doctor?
Usually it's the same day. So there are times, that's something, and let me just expand on that by saying that's for our established patients, but we are, as Erin shared, sometimes folks have a doctor out in the greater Rogue Valley area, and sometimes it can take weeks to even get into that doctor. And so for our residents that are not established with Dr. Rushton, in September, we're actually opening up those same day visits to people that are not receiving their primary care here, versus them having to go offsite to an urgent care facility. So one of the reasons we designed our practice the way that we did is so that we would have that access for our residents, because it's really important. What you can get seen quickly and get addressed quickly will likely be hopefully not become something bigger and worse. So we like to be able to offer that access quickly.
Access is a huge thing, and I even feel it with my provider. But I will say, the Sante system, the primary care providers, a fully panel providers, but 2,500 is what I've been told, and I know that because my wife managed some of those clinics. Our panel providers, we're talking 700.
Between three providers.
Between three providers. So you see the difference. Access is a huge undertaking when you're a fully panel provider of 2,500 versus 700 between three. So I think you're kind of understanding where, our concepts are, I would say ahead of the curve when it comes to access and need, especially when we're talking elderly residents, which most, patients out there, that are Medicare age, we're talking like a 1% to 2% case mix, per private clinics, that they're allowed. And that's why they're not accepting new Medicare patients, because of the payout. Well, we understand our model here. Our model is geriatric communities. So that's why we've acquired that in-house. And as you can tell, it's really made an impact when it comes to accessibility. So.
One other thing I'd like to point out about the clinic is we have three providers. They're on a 3-provider call rotation. So we only have those 3 providers. And if you call after hours, because we always have a provider on call, nights and evenings, holidays, weekends, you will get one of those 3 providers. And it will be someone that likely already knows you or knows of you and will easily be able to access your records and be able to give you advice that's real time and driven by your primary care provider's office, not by an after hours call service.
Thank you. As a follow-up on this issue, once somebody moves here, the importance of access, as you said, is an issue. Are there any other considerations that one should be taking, thinking about whether to switch from their own provider in the area or a provider
here?
You know, the benefits, I think, of switching to one of our on-campus providers are you have someone who is already integrated within the continuum of care, already knows who to contact if there's a change, and is really invested in your overall health and well-being. Not that every primary care provider is not invested in the same way, but for example, Dr. Rushton sits on our transfer committee. So as we're trying to make recommendations on what an appropriate level of care is, she's able to be a voice for her patients in that setting in a way that off-site providers are not able to engage. She's also very integrated with our therapy program as well as our wellness program, which is just an added benefit that you wouldn't experience if you were seeing an outside care provider. And I think what the other sort of integrations are, you know, obviously skilled nursing, memory support. I like to call it the house call system. You know, we brought back house calls here at Rogue Valley Manor. So for our residents that aren't able to get down to the clinic, which is just in the lower level of the terrace, it's really easy for our providers to go to their home in assisted living, memory care, or the health center and see them there.
Thank you. I have a question, to follow up on the previous question about access. And that is, what you have here is phenomenal. But what about leverage or relationships with outside providers, specialty providers, orthopedics, neurology, or whatever?
So our clinic is considered part of the Asante Health Network. And so that gives us enhanced access to any of the specialists within the Asante Health system. So we have a partnership with Asante that gives us that elite access. Now, unfortunately, in the Rogue Valley, there still are some specialty providers that are hard to get into, gastroenterology and urology among them. However, it does give us a leg up on the other smaller practices within the Rogue Valley and getting into those providers as quickly as possible. And because we are part of the Asante Health Network, we're able to do those referrals electronically through the Epic system. And so we're not having to deal with faxing things back and forth. It can happen very quickly and very efficiently.
I was really happy to hear that Asante alerts you if a resident is admitted. What's the barrier to Providence doing the same? And what's the best workaround, just to have a loved one call you and let you know that they're at Providence?
Great question. So I also have Providence access. So if I do see an alert come through, like through our security log, I'll come find you. So I do have access to their network as well. Our Asante Epic has a link, what we call Care Everywhere, which also links to the Providence portal. So they can access your information through the Asante Epic platform, which you would think with clinical EHR, they would all be the same, but no, they're not. So unfortunately, we stopped to go looking for some records. But we do have access to Providence. So a lot of times if I see an alert, as long as our security system has been in place, I'll know about it, I'll be able to access it. And I have went to Providence and seen our residents over there as well. So it just depends. But if we don't know about it, or if you have a surgery that we don't know about it, a lot of times they won't notify us because we don't have a patient provider panel through Providence. So I won't really know. So yeah, have a family and loved one tell me, or what have you, and then I'll get in contact with the hospitals. Just so you know, we also reach out to area hospitals like up in Portland, OHSU, we've contacted them before. Stanford, we've contacted other outlying hospitals in the region on your behalf, especially when there's like specialty surgeries that may not be able to be done locally. We will contact them and devise plans on your behalf. Again, behind the curtain to make sure that what you're coming back to is safe. So of course we do work with all the hospitals regardless to access or not.
Kind of along those lines, if you, for example, with the one of the specialties is not really available here. And we know a number of people who had to go to Portland for service, to go to a doctor, specialist up there. Do you help with that, to find somebody and make that happen, or how does that work?
It's still a referral process. So our clinicians they'll send the referral to those specialty practices. It's not something that's attainable here. Like Melissa said, we do have the Asante network, but because we now have our own clinic in-house, we also dip into Providence as well. So some of the specialties I know that may not be at Asante, Providence does have. So, we will definitely adjust our resources here. And if it's something that you are saying, hey, I really feel more comfortable going elsewhere, they'll help you with that. They'll definitely help you with that, especially some people that are established in the Bay Area. We still have some residents that have their connections into the Bay Area. So we understand that, and we don't want to, disrupt those relationships that you guys have, but we will work with them as well.
I'm thinking of one situation that happened recently, and Aaron, you'll probably recall this, where we had a resident that had to go up to Seattle for a very specific type of medical procedure. And they needed to recover in Seattle because they wouldn't be able to travel immediately after. And Dr. Rushton was able to help coordinate that referral, get that surgery scheduled. And then Aaron, I think, even assisted with the follow-up care and looking at different skilled nursing facilities in the Seattle area that could accommodate them. So just because you're not here with us doesn't mean that you're not our resident. We're still going to look out for you and help navigate the system.
Would you help with transportation?
With transportation, absolutely. We may not be the one that can provide that transportation, but we have a lot of resources that we can connect folks with and make those arrangements.
Going beyond your local scope, if we're traveling, most of us can get care, Medicare, supplemental insurance and so forth, but how might we have to relate with you or you with us if we're somewhere else in the world?
I can actually take this one. I've had a few of these. So we have residents that travel all the time, and the biggest thing is carry Aaron's phone number, carry my phone number with you, something where you can say, hey, I have a skilled nursing facility, say you go to Eugene to watch graduation or something. We've had events like this, you fall, you break your head, you're at the hospital in Eugene. It's a 3-hour ride, so we work with the hospital there to get you back to our skilled nursing facility. And if you're off, then we have some skilled nursing facility at one of our sister communities. It's really easy to coordinate with them to get you, so you don't have to, take a gurney ride 4 or 5 hours away. But if you communicate back with us, if we don't know you're out on vacation, we need somebody to tell us where you're at. But if you say I'm at the Rogue Valley Manor, you have a discharge planner at the hospital, they'll get in contact with us and we'll try to game plan a way to get you back as safely as possible.
Yeah, we've helped residents from California, from really all over the place that have needed to get back to us in order to continue their recovery. Oftentimes it's a short-term stay wherever you're traveling, and then it's just a matter of us working out the logistics to get you back home.
Yeah, I had a situation happen, I think it was in China, where we had a resident group that was doing a tour over in China and suffered a stroke. And so, interesting enough, the imaging that we were trying to get back from China to our doctors here, Dr. Rushton, it was in Chinese. So we had to have an interpreter, and it was quite interesting. It was a first for me out of the 20-some years I've been a nurse. But we were able to bridge that. We were able to get the information down here, including the CD that had the CT scans, to the neurologist locally. Mind you, this person was still in China. We were getting the information here, getting things prepared so that when the transfer came over, in fact, they came over, I think, with a nurse that was provided through their insurance company in transfer. And then Dr. Rushton got involved right away, as well as the neurologist by the time they got to the mainland. So I've seen some pretty unique things, including interpreters and things like that being instituted. So I don't think there's been anything outside of impossible that I've been a part of. That was the most unique, though, I can assure you. But it was, fascinating.
I have 2 questions. One on Epic. My current doctor in Grass Pass does not. Because I've been fighting with him since I joined him, because I come from Geisinger, where Epic was really big. And so will you be able to transfer the notes?
Yeah, absolutely. Yeah, what we'll do is usually they'll come across to us in a disk format. We'll just upload them all into Epic, and then you'll be back in Epic once more.
Okay. I mean, I am partially using the blood work, etc. in Epic here, but not my other notes. Yeah, thank you.
And that actually, that reminded me of one of the things, but you asked your second question first.
Yes, the second question is, Does Dr. Hirschman take new patients? I mean, she must be inundated, right?
She is accepting new patients, yes, yeah. Only residents, staff, and family members, though. One of the other great resources we have on campus is we do have our own on-site lab. So whether you are a patient of our clinic or not, you can have your labs done in our clinic, and you can just show up and they'll draw your blood for you, and then you'll go back off to whatever you were doing for the rest of the day. So that's a really great benefit. You're not having to drive across town on a fasting stomach in order to get your labs done before breakfast.
I don't have a question, but I want to pass along an accolade. Several years ago, a friend moved from just Jacksonville, a small farm, into the manor, and then 3 weeks later had a brain aneurysm. Within 5 minutes, he had support. He was on his way to the hospital, and he is doing quite well. He had to go through a learning process, learning how to eat, learning how to walk, and the manor helped him get through that. If he had been on his little farm, he probably would not be able to know. Thank you.
Thank you for sharing that, and I'm glad that is exactly what his experience was.
And I do want to sing praises to the skilled nursing facility. When they have room, often there will be a public admin. And inevitably, they will then call my office and say, we loved it so much, we want to move into the manor. I hear lots of good things about the nurses and the food. And people just really enjoy doing their rehabilitation there if they've had a procedure. So it is sought after even outside of our residence. Any other questions?
So in the area, you say you're part of Asante. Of course, we're hearing a lot of things about what's going on with Asante. How is that affecting what you're doing?
That's a great question. So we are part of the Asante Health Network, which means that we have an agreement with Asante where we purchase Epic from them. So that's the reason why our clinic, which is such a tiny clinic, is able to have Epic, is because we purchased that through Asante. So we have a contract with them that provides us that access. And the benefit of being part of that network is that it enhanced access to their specialty group. We are very well buffered from what is happening there right now. However, what I would also say is this community is feeling the impacts of what is happening there. And so it's something that we keep very close to the top of our minds because our clinic is such an important part of our program. If that Epic access were to go away, that would be a significant change for us. So we're always keeping in the back of our mind some contingency plans on what that might look like. Several years ago, 2 years ago actually, we contracted with Asante to provide our on-site clinic. So our Dr. Rushton and Veronica Berg were employees of the Asante system at that time. But what we found is our model is very different from your traditional clinic model that Asante operates. And it really made more sense for us to have control over the decisions that were being made in relation to the clinic operations and how we wanted our clinic to operate for our residents. And that's why we brought it back in-house and assumed management and re-employed our providers as being Rogue Valley Manor employees to future-proof our clinic from any changes that might happen down the hill. You're welcome.
Any other questions? All right, well, thank you all for coming, and thank you all for coming. This is an absolutely wonderful. There is so much experience at these tables, and I really appreciate you taking the time out of your day. They were very deep. So thank you very much again, and thank you all for coming. Again, we can send out, Melissa, can we have the PowerPoint as well, please? We'll send out the video and the PowerPoint for anyone who didn't take notes, and you can look at them at your leisure. So thank you all for coming. If you have any other questions, feel free to grab me or one of the sales counselors, and we'll be here to answer them.
Cookies.
Yeah, it's a lot of information.
Well, answer that, because you're talking, that's the way this movement. No, you're out of
We're ready.
Not having it. We have let me go to this one.
Like 2 to 3 people per room. So we only have one wall.
Thanks. Any other questions?
I asked him for it because I didn't have a copy. He wrote back. Yeah, just print it out. Everyone would you'll get a copy of the slide and the link to the Turn off the live stream here. There's probably people still watching. Yeah, there's still 5 people watching.
But I've learned that from many residents. Everybody says, yes, travel. And that's the first in the industry. I was like, go to a club where that's yeah, so anyway, yeah, then you get oh, absolutely. Give it a small kind of caregiver, which when I was there, yeah.
I have to take a cookie with me to go.
Thanks for the questions. Love it, yeah.
One more. Always have one more.
I don't know, I'll look when it comes out and I'll put it out, you know, it's using.
Okay, thank you.
You bet.
Sorry.
No, she must chat longer than I.
Okay, then we're gonna be ready.
I know. Well, you're my next, I just didn't know how long this was gonna go. I thought that I needed to. But I'm the. I was in the computer. I know you guys don't want to sit down and I didn't, well, it's wrong, I would say you're the one from Hawaii. That's also. Let's go. No, I'm sorry, I don't work.
They done, huh?
They are done.
Oh.
And I'm done. I'm overdone. There's one cookie with your name on it, though.
I could have one. You can have that. Oh. Oh. I wish the lady would. Oh. Just have to like that. Oh. And that's it for this week, huh? Do you have any other? Oh yeah, Friday. But I don't think they need to.
What's going on Friday?
Sabbath, whatever. I don't know what the hell is that.
Oh, Shabbat.
Shabbat, yeah. Shabbat.
Yeah.
What is it?
It's a Jewish meal.
Oh.
Jewish tradition.
Oh.
And that's in,
Yeah.
that's in the shoes. They just, for me, they just need a microphone.
Oh.
But that's it.
Yeah, that's what I mean. This is what this week. Yeah, Ron. Da, 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 da. Oh, I have some veggies, some fruits.
I got it back. Whatever Pam told you I said was completely a lie.
Has she ate my enchiladas?
Did you tell her?
I brought them
Because
for her.
Because my response was, well, whatever the case, she can stand to skip a couple of weeks.
Yo, you're not wrong.
Oh.
No, I brought them for her. I come from a family of like 9, so the only way I learned how to cook was for a small family, or for a small army.
Yeah.
It's only to 2 of us, so like I made 30 enchiladas for 2 people. I was like, this is ridiculous. This whole family.
This stuff belongs to you?
Yes. Yeah. Thank you.
I told her, I was like, I'm surprised you got the strength to eat only half.
It smelled amazing in there.
David's off today?
Yeah, sure is. I know. Riding solo.
Minutes and pigs.
You're probably camping.
Probably. I wouldn't be surprised. I think that is usually what he does on his days off. Always up at Lake of the Woods.
Yeah, Lake of the Woods.
He deserves that.
What's that?
You don't have to worry about that.
There's a recycle bin here.
There used to be, I don't know where it went.